Hey, Dr. McCann here, and so I see this all of the time. You've been diagnosed with PCOS and you've been told that you need to lose weight. You've changed your diet, you've started exercising, and you may have only lost a few pounds. Maybe you've even tried intermittent fasting and still nothing. The weight is just not coming off. And so the question I get is, why is it so hard to lose weight with the diagnosis of PCOS? While there's still a lot of research going on with PCOS, it's thought that one of the main underlying factors is insulin resistance. And so what does this mean? What exactly is insulin resistance? Well, to answer this, we're going to take a quick look at insulin first. Your pancreas releases insulin in response to sugar or glucose in your blood. So after a sugary meal or a meal with starchy carbs, you're going to release even more insulin than you would after a meal with a lot of protein in it. So this insulin that is released then binds to its receptors on certain cells in your body, and it tells those cells to take in that glucose to get it out of your bloodstream. And depending on what receptor binds to what cell, depends on what this glucose does. So if you are uptaking this glucose in your muscle, then you use it as energy. Extra glucose is stored as fat. With insulin resistance, the receptor doesn't recognize the insulin, and therefore it's harder for the glucose in the blood to move into the cells. Therefore, you have more glucose in your blood after meals. However, there's more glucose in your blood after fasting too, because your body is not recognizing the receptors. Your liver makes glucose after a period of fasting for your body to use in your brain and energy if needed. However, your receptors aren't recognizing that there's already glucose in your blood. So your liver is making more glucose, and there's already glucose in your blood because your receptors aren't taking it in. And therefore, you'll have higher blood glucose levels fasting or first thing in the morning, as well as after meals. So here we have the hunger cycle. And when you take in starchy carbs, these start turning to sugar molecules right when it hits your mouth with your saliva. So after this, the carbs are broken down into glucose, your pancreas secretes insulin in response to this glucose. However, your cells don't recognize the insulin. So you have a lot of extra sugar in your blood. And this sugar is eventually stored as fat because your pancreas is going to keep releasing more insulin. So you have a higher insulin level, you have a higher blood glucose level. This extra glucose is eventually stored as fat when your body finally releases enough insulin that it is recognized. And then when all this glucose is stored pretty quickly, you get really hungry. And so the cycle just continues. And again, this extra glucose is then stored as fat instead of used for energy. So now we need to figure out how to break this hunger cycle. So how do we break the cycle and actually lose weight? I'm going to go over a few tips that I've learned clinically over the last 10 years that can help women with PCOS lose weight and in turn improve fertility, improve menses, and balance hormones. To be clear, I want to mention that ACOG, or the American College of Obstetrics and Gynecology, does have recommendations in a practice bulletin, and the recommendation states that an increase in exercise combined with dietary change has consistently shown to reduce diabetes risk in women with PCOS, comparable to or better than medication. They also state that in small trials, women with PCOS that the trials suggest that there is no ideal dietary modification to women with PCOS beyond caloric restriction. However, I am going to offer some recommendations in addition to caloric restriction that I have noticed clinically to help women with PCOS over the last 10 years. So the first of these recommendations is going to be what I call the natural way, or without medication. And this is going to be, again, your dietary modification with the caloric restriction. So again, keep in mind with PCOS that you have an increase in the glucose level in your blood that goes along with insulin resistance. So to decrease the sugar in your blood, obviously we need to decrease the amount of sugar and simple carbs that you get in your diet. So obviously, stop eating or drinking anything that you know is sugar, including juices, Cokes, candy. If you know it has sugar, just go ahead and stop. However, you may not know that a lot of carbs, especially the simple starchy carbs, can turn to sugar as early as your mouth. So as soon as you start chewing, your salivary enzymes can turn a lot of these into sugar. And then it's absorbed again as sugar in your bloodstream. And we have been over that does increase the glucose in your blood because you're not recognizing your insulin. Therefore, a very effective lifestyle change that you can do with PCOS is the ketosis diet. So in this diet, instead of using glucose for energy, you actually burn fat for energy. So when that glucose, remember there's a lot of it, it's stored as fat. And so if you're in ketosis, you actually burn that fat for energy. So with the ketosis diet, you can pretty much be assured you'll be in ketosis if you take in less than 20 grams of carbs a day. And if you're in ketosis, you burn the fat for energy. Everybody is a little bit different. Some people can take in a little bit more than the 20 grams of carbs, but almost everybody will get in ketosis with 20 grams of carbs or lower. It can be very difficult to get started on ketosis, but again, it is very effective at losing weight and burning that fat. So if you are unable to adhere to ketosis to where you're consistently getting under 20 grams of carbs a day, again, it has to be consistent. You can't do it one day and not do it the next day, because you'll more than likely gain weight because you'll be taking in too much fat if you don't stay in ketosis. So you have to adhere to it. If you can't adhere to it, or if you have another medical problem to where your primary physician does not want you to be in ketosis, then another option dietary-wise is carb moderation, meaning you're not in ketosis, but you're still keeping an eye on the amount of carbs that you take in. And again, generally it's going to be better if you don't take in those starchy, sugary carbs. You get a more complex carbohydrate when you do take in carbs. That is going to be better as far as your blood sugar level goes. So generally with carb moderation, you're going to take in about 35% protein, 35% carbs, and 30% fat. So in this dietary restriction, you do have to watch your fat intake, because remember, when you're not in ketosis, you're going to be burning glucose as your energy source. So if you take in too much fat, you will actually end up gaining weight. So both ketosis and carb moderation, along with exercise, is very effective, natural way to help lose weight in women with PCOS and insulin resistance. There are some medications that are also very useful to help women lose weight. The most commonly used medication in women with PCOS is metformin. A lot of women with PCOS are put on metformin. It is thought to help with ovulation. So what does metformin actually do? Metformin decreases glucose production by the liver and increases insulin sensitivity and the sensitivity of the receptors. You can have weight loss with metformin, but it does help with your insulin sensitivity. And another more effective medication is the weight loss injections. Again, the semaglutide or the Mounjaro. They work by increasing insulin secretion and delaying gastric emptying. And as most people know, these weight loss injections have been very effective in helping women lose weight, and it is effective in insulin resistance also. With the diet, either whether you're using the medication or you're just trying the diet by itself, you can add in foods from what people call the PCOS diet. Now, you have probably heard of the PCOS diet, and what is this? This is based on some studies showing that foods high in certain vitamins like vitamin D, vitamin B, iodine, selenium, magnesium, and omega can help with insulin resistance. And this is the basis of this diet, is these studies that show these can aid in insulin resistance. So some of these can be incorporated, regardless if you're using medicine or not, into the PCOS diet. And these include some foods like tuna, salmon, and whole grains. Some of these also mention nuts. Again, you still have to watch out for your fat content in these foods while you're losing weight. Again, unless you're in ketosis, you have to watch that fat content. If you're in ketosis and staying in ketosis, you can take in all the fat from those healthy foods and nuts that are on the PCOS diet. So to recap, it can be very hard for women with PCOS to lose weight, but this weight loss is very important to help with menstrual irregularities, to help balance hormones, and to help improve fertility. Exercise along with caloric restriction is useful for helping in weight loss, and that exercise has shown to increase glucose uptake and increase insulin sensitivity. So it helps with PCOS and insulin resistance. The ketosis diet or carb moderation are two diets that can be used in addition to exercise to help lose weight with PCOS, as well as medications like metformin, and the injectables like the semaglutide or the Mounjaro are also effective with insulin resistance and PCOS.